Hello, international folks around the Nakseonde Station area or Seoul National University dormitory area. I am Yi Kwon-woo, a medical doctor specialized in anesthesiology and pain medicine. I am operating my own pain clinic, Moses Pain Clinic, near Nakseonde Station. And I am very happy to tell you about the Herpes Zoster these days because Herpes Zoster is very rampant in Seoul area these days. So I think it's the same condition to you, the international folks around this area. And as a medical doctor, I think I have to tell you about this. And I have to give you the information about herpes zoster infection and the natural cause and the treatment policy about it. And the herpes zoster is basically a viral infection to the nerve root, nerve structure. But we think it originates from the chicken pox infection in early childhood. Usually the chicken pox happens in childhood and it completed soon, but the virus is not totally eradicated. Instead, it stays within the nerve root, some cells around the spinal cord, and usually it keeps silent to the end. But when the person is immunologically compromised, to say the health status is very bad, the virus will reactivate and multiply, and it makes troubles to the body. It is called as a herpes zoster infection. The virus travels through the nerve root and nerve structure to the peripheral and it arrives the skin area and it makes trouble there. The herpes zoster symptoms can become through the viral actions like severe pain, neurological pain, and sensory deficit, some abnormal sensation, and some skin lesions like rash or vesicles, eruptions, color changes. That's the herpes zoster symptoms. And herpes zoster infection usually starts with a 2 or 3 days fatigue and exhausted status. And after that time, you can find some symptoms of the some herpes zoster virus, like the nervous symptoms, pain and tingling, and some squeezing pain or electrical pain, and some sensory deficit, and with simultaneously the skin lesions. And then in 2 or 3 days, the symptoms aggravate and get stronger, and you cannot tolerate it more. And then that time you usually visit clinician, the pain clinic. And as a medical doctor, when I see patients at that time, it's very typical to the herpes zoster. And we test the immunoglobulin and diagnose and start to treatment as soon as possible with the antiviral agent and the painkillers, and even interventionally we applied nerve blocks together. And the symptoms maybe subsided, and you can endure the natural cause very well. Usually viral infection, some follows from start to the end, it takes about 2 or 3 weeks. So as the herpes zoster also followed that course, and it completes in 2 or 3 weeks. But the problem of the herpes zoster infection is it can leave a very severe pain symptom after the completion of the infection. It's called as a post-herpes neuralgia. It occurs about around 10% of total infected cases. So, one or two people of the herpes zoster patient may experience the post-herpes neuralgia, very difficult symptom to manage. So, the treatment goal of the herpes zoster infection is to prevent that sequelae, that complication, post-herpes neuralgia. So when you feel some kind of symptoms like herpes zoster, as I told you, please don't hesitate to visit my clinic or other pain clinicians around you. So this is a very beautiful spring day, but herpes zoster must be prevented. It's rampant in Seoul area, so be careful, watch out. Thank you very much. Enjoy beautiful spring days of Korea. Thank you.